Hi, everyone. Welcome back to the podcast for the Center for Asian American Christianity. It is my delight to host a conversation with a very familiar speaker from past mental health conferences, Dr. Jessica ChenFeng. Hi, Jessica.
Hey, David. Always good to chat with you.
It's great seeing you. And just by way of introduction, Jessica is Associate Professor of Marriage and Family Therapy at Fuller Theological Seminary. And she is also director of the Asian American Center's Wellbeing Collaboratory. And we want to give a shout out to the Wellbeing Collaboratory and all of its important work for advocating for mental health related issues for the Asian American Christian community. So, Jessica, we were talking about some of your work before you arrived at Fuller Seminary, and you were at a medical school, and you were describing some of the explicit and implicit training that medical residents have, what physicians are trained to do with taking medical history, medical inventory, medical histories. And I'm interested in the spiritual analogy here about what is implicit or explicit with the kinds of histories we know and the kinds of histories we know and we tell and that we may not know and therefore not tell. So
Hmm.
that's a lot. Let's just begin with your observations regarding medical training and how physicians and medical students are trained to inventory medical histories. Could you just describe a little bit of that context?
Yeah, for sure. And I didn't mention this other part, which I'll weave into it. So, part of why I started thinking about this is one of my roles at the medical school and the hospital was introducing to medical students how to increase your awareness of your own well being and mental and relational health. And so, um, I had to really think about, and I had been working with the medical students and the residents for a few years. And so, very familiar with the medical culture and had to create a lecture. And so, in this lecture, I had to think, okay, what is the best way to support medical students in gaining this knowledge and making it accessible? And what I want to say is, in general, anytime we feel that there's stigma or there's a barrier to mental health issues, it is not a personal problem, so to speak. Like, none of us did anything where we on purpose internalized negative messages about well-being and mental health. These are typically ideas that were shaped, passed on to us in our social context. So then with that, the parallel in the medical world is, obviously, I would think most of us, if not all of us, have been to a physician to get your annual checkup. We fill out all these inventories from day one. The medical student trainee learns to take the medical history of their practice patients and then their real patients. And so the language of, okay, what is a history of hypertension in your family or diabetes? And so the average person, if you go to a doctor, is generally prepared for that. Maybe you know on your dad's side, this is the medical history. On your mom's side, maybe these aunties had it, your grandparents, whatever. We in American Western society, physical medical health is sort of a given in terms of what we're socialized to be aware of. And so for physicians, of course, it's their job, it's what they do. What I learned about how to teach and socialize medical students into caring about mental health and relational health is asking, okay, so you know how to get your medical history. Do you know how to get your own relationship history, right? How were relationships modeled by your parents, with your parents among their siblings, your parents' relationship to their own parents, right? And do you see patterns of relational health or mental health that were passed on to you? And so that made it more like low hanging fruit, easily accessible for a physician learner to think, oh, I've never thought of that, but that makes sense, to track that pattern similar in the way that we track medical health. Yeah.
Fascinating. I love that medical school analogy. How did the residents and people under your training respond to this notion of taking an inventory of relationship history? So, why is that important for their professional development or even personal development?
Yeah, great question. So, oh gosh, we could talk at length about this, but the overall picture is most people who go to medical school spend their college years studying really hard. Right? We all know this. To take and pass your MCAT, apply to medical school, it's such a rigorous process. So a lot of, and then once you're in medical school, all you're doing is studying and doing school related things. It is a very different developmental trajectory than their peers who are studying other things, maybe getting to go out, date, connect, whatever, like the social things that late teens and early 20 somethings are typically doing. And when I say this, this is not a put down. We all have different sacrifices given the careers we pursue. For the medical learner, it is often their relational training, um, normal, teenage, early, young adult, heartbreak, all these things, they don't have that traditional trajectory because they're studying and focusing so hard on a future either they want, their parents want, whatever. Um, but then they don't get to have, sometimes in medical school, because you're so pressed for time, you're lacking sleep, you're not eating very well, your relationships really suffer, right? So even being able to communicate to your family things like, I'm so sorry, I have this huge exam coming up. It doesn't mean I don't want to go to your wedding. I simply can't. Your wedding is taking place 2 weeks, right before this huge exam. And it's a very unique life season and trajectory. And I share all this background because they end up experiencing what we're going to talk about today, relational ruptures, confusion about why this date didn't go well, or why this person, after several months of being together, doesn't want to be with me. All these sort of challenges related to their medical training. And so there's just a lot around that comes up.
Wow. You mentioned rupture and by inference, repair. You and I have been talking about ruptured relationships and the desire to repair them, especially from a Christian faith perspective. I just remember a really good friend of mine, and he was talking about Thanksgiving dinner with the family. And he said something to the effect, and he's a Christian person, Christian family, and he's like, if this uncle's going to be at Thanksgiving, I'm not going.
Yeah.
Because inevitably the conversation goes south
Hmm.
and it becomes very uncomfortable.
Yeah.
And I think within the Asian context, this is compounded with sometimes our inability to know how to navigate broken relationships. We just have a tendency to sweep under the rug
Yeah.
things that are negative, discomforting, or just, relationally fraught, or we just don't show up.
Yeah.
um, so I imagine that these type of cut off relationships or ruptured relationships, they're not going to get fewer in number. I
Yeah.
think since COVID, um, there are any number of issues that could potentially divide Asian American families, Asian American churches, whether it's over masking or vaccinations or what have you. And there's a biblical mandate to love your enemies and to care for your neighbors and to seek mutual understanding and to live as the under the unity of the body of Christ, right? So there, I'm thinking of all these theological mandates that our Lord left his body, and oftentimes unaddressed trauma, personal pain, hurts, wounds,
Hmm.
especially with loved ones over issues of rupture and disagreement, profoundly impact our ability to live the Christian life.
Yeah.
I'm couching it in Christian terms, but also just make life a relational hell
Yeah.
at times.
Yeah.
And so that kind of sets the context for this rupture and repair situation. And I'll pause there before I kind of go on to the next one if you wanted to comment on anything.
Yeah. I mean, there's so much as you were talking. I want to just say that as we talk, and I'm imagining all the different sort of listeners we have, I think the most important thing is extending kindness and grace to ourselves and our family members. Because every generation, every family, given its complex and different history and experience of things like trauma, different things that people have survived through, different cultural expectations, that shapes our capacity for, our understanding of repair. And so you and I are having a conversation in a North American, second gen, East Asian American context, and so much more, right? But we have language, we have training. You and I, like, have looked into therapy, spiritual direction. Like, these shape our ability to talk about this. And so, what we're modeling and what we've had access to is not what every listener does, nor our parents or our elders. So I share that because it's easy to hear this and be like, oh, I should do that too, or expect this of my parents. But, and then that can heighten the pain of rupture, which is valid. And to also realize, you know, someone's particular parents may not have the access to this knowledge in order to converse the way you and I are. So that's kind of what I'm thinking of. Yeah.
That's powerful. It is not one size fits all.
No.
I love your articulate contextualization of this conversation. It's so true. So I want to reflect with you about story collecting as a spiritual exercise, as a
Mhm.
spiritual practice.
Yeah.
What does the mundane have to do with who we are as children of God when it's not explicitly conversion related?
Mhm.
You know, the 99% of life before and after that decision.
Yeah.
So, you know, I spent a lot of time thinking, well, of course it's got to be relevant. God created all of us, not just
Mm.
that time and space when we said the sinner's prayer. But I don't often see that reflected in the ministry practices of the church, where the church normalizes or invests or kind of uplifts telling our stories as a practice of discipleship and formation.
Yeah.
It's because many of our seminaries focus on the head knowledge piece, the
Yes.
explicit
Yeah.
theological curriculum. You got to know your biblical Greek, biblical Hebrew, your systematic theology, your church history, and then the 3 point sermon and narrative arc of that, and boom, you're ready for ministry. But notice in all of that theological curriculum, what work is done on yourself,
Yeah. Yeah. For
right?
sure.
So can as a MFT professional, could you maybe speak about this explicit theological curriculum and the need to
Mm.
make more explicit the personal implicit theological curriculum?
Yeah. Yeah. And a lot of what you were just sharing, I'm hearing, professors, theologians, pastors who are shaping the explicit knowledge base, right? What you learn in Sunday school, what is sort of centered or privileged as important information to know about, important stories. And so, I reference that because, I mean, the question I ask then, which this is not my wheelhouse, is like, societally, the movements of history, how did cognitive knowledge get centered, right? like enlightenment, all these things that is not really my thing, but I know historically in the West, these are things we tend to value. Um, and in the field of marriage and family therapy, one of our hallmark terms is we call it self or person of the therapist. So from day one, most MFT programs will in at Fuller in the Christian world we call it formation, right? The formation of the person of the therapist. But we tell our student trainees you can take your clients as far as you have gone in your own life, right? And it's sort of parallel to, I know, the thing you were referencing earlier. But my awareness of myself, the work I've done personally, then it becomes part of my conscious awareness. Then I'm functioning out of that knowledge. It's hopefully embodied, it's integrated into who I am. Then I have the sensitivity to be attuned to that in another person, right? And so this is where the whole like explicit implicit processes, right? Many of us know about implicit biases. When biases remain implicit and we're not aware of what biases we have, they show up in times of stress, right? And so it's in the same way, it's like, to what degree have I worked through my own anxiety, my own family history of depression, right? My inclination to be to yell and get upset when I'm stressed out about whatever it might be, right? And so the work I put into that allows me to notice it in another person, understand what it's about, and sort of monitor my own reaction time. So yeah, that's the gist of sort of family therapy training.
Wow. I think not just therapists, but all persons involved in some service or ministry or work of care, like relational care, need to have this self work
Yeah.
process, especially pastors. And some seminary curricula are better at doing this than others. I think this notion of like self work, working through my anxiety, I want to weave this back into our life stories.
Mm,
So, so when we're talking about the person of the therapist and the need for people through the MFT program to do some self work, how much of that is narrative based? Like, how
mm,
much of it is understanding our own particular history
yep.
and working through some of the pain points or joy points? So, talk about the role of story collecting
Sure.
in this self work.
Yeah, sure. When I'm teaching students about various models, one of the givens that we talk about is a therapist's transference and countertransference. That's one way of talking about it. So this is more psychological language, right? What shows up for you, what's getting activated in the client, and this sort of like the unconscious processes that could either be helpful or potentially hijack a therapeutic healing process, right? And so we want to be aware of, oh, this is overly simplified, but let's say I've got challenges with, um, a history of whatever with my own mom. And so when I'm working with a client who's a mother, maybe it activates something in me that then I'm not as able to be helpful with this client because something about her is just triggering me. I need to learn about what that trigger is or set of issues is, and be working through that. So I'm not going to cause harm to the client or it's not a blind spot to me, right? So that's just a given in the training of a mental health clinician that our only tool is us. I mean, we have assessments and things like that, but we don't have like scalpels. We don't have, whatever, right? So I have to know and refine me as the tool in order to best serve the client. Yeah.
In one of our earlier conversations, I forget what we might have been talking about things like pastors and burnout and the expectations from the church community on what a good pastor is.
Mm.
And then moms with, they have a job, but they're also like a spouse, and then they have children, and then what being a good mom means and how we're socialized into that norm. Or like a man, an Asian man, who is socialized to not discuss their need for assistance or help, or when they feel weak and need supports, and how they may react helpfully or unhelpfully given these pressure points, stressors, and anxieties. And the reason I listed out like this is, you were saying at bedrock is their sense of self,
Mm.
because that will affect how they respond in the moment,
Yeah.
whether they feel bad or good about themselves. Can you just, I'm using very clumsy language. I called this sense of self like, do we know that we're made in the image of God? Do we know that we're a beloved child of God? I'm grounding it in these theological concepts of personhood
Mhm.
that kind of orient us. But you also had additional language and concepts here, and I just invite your reflections.
Yeah. I'm not sure if this is what you're referencing, but as you share, this is what I'm thinking of. And again, coming back to our Asian American context, right? In general, right, the whole idea of collectivism. I don't know all the points how scholarship says, oh, this is how you define collectivism. But one thing that's clear in terms of our relationships is that as communities with this kind of shared heritage, we are aware of social norms and expectations, family rules, what leads to saving face or not. These are things that in many Asian and Asian heritage families, it's sort of in the air that we breathe. And what I want to say is a lot of times in our Western society, right, there's all this negative attribution to that in terms of parents shaming children for this or that, or the growing up with this like negative sense of self, as if we could say, oh, this type of parenting is bad because it creates this negative sense of self in the child. To me, that is a very unfortunate elementary understanding of the very complex, what I'll say is like relational ethic ecosystem in our Asian American families. And so there is something beautiful about a child being raised to notice the other, be attuned to what others are thinking and feeling, and then responding to that, right? So there's some beautiful parts. And what that can do to a child is, because we're being socialized to care about what's going on in the community, the relationships, what people perceive, it can be easy then to miss out on developing your voice, right? Being attuned to what's happening in here. And I'll share by way of, I think personal examples are always the best, right? Because it's easier to track. As a Taiwanese American woman, right? Like my church context, my family context, where there is internalized patriarchy all around, and as an older daughter, right, I'm learning to attune to everyone. What are other people's needs? What are other people feeling? How can I make people not upset? And a lot of older siblings joke about being people pleasers, right? Not causing disruption, not making it bad for the family. All these things we know how to do. But it was not until my 20s that I realized, oh, where's my voice, right? And who are the people asking me, what do you want to do? What do you want to eat? Something as basic as like, what would you like to eat? And even to this day, I have to listen to myself very thoughtfully, right? Because I'm grateful my husband, the people close to me genuinely want to know, Jessica, what do you feel like eating? And, where do you want to go? And I have to think, do I have a strong opinion about that right now? Um, or do I not? And it's okay for me to defer, right? It used to always be for me, defer to others, let other people pick. Um, I don't get frustrated by it. And I can see this work out in me. But early on in my development, that can lead to resentment, right? Passive aggressive behavior, right? Usually we say people who are passive aggressive is that societally and in relationship, they have less power, and so they have to figure out other ways of communicating because it's not safe or wanted for them to express what they want directly, right? And so it's important, like when our kids, mama can be strong, very headstrong and very opinionated. And so when my kids, I sense that they're tentative about something, and I'm instead of saying, why are you being so indirect? I ask, how am I being to create an environment that makes them feel like they can't tell me directly, right? And so, all of it to say, our environments, whether it's our churches, not valuing women's voices as clearly and as centrally, or it is parents having one way directional communication and expectations, we're out of practice in hearing the voices of our children. We want them to pursue a particular career, right? Those are fair for parents to have those hopes and expectations. But do we know our children's preferences and strengths? Do we know who they are as God made them to be? Does it really align with the hopes and expectations we have? Or is there some degree of forcing on it, right? And I think all of us know that tension of expectations, things put on us. Does it actually align with who we are? Is it a mixture of these things? I'll stop there, but I could go on and on about just how culturally, all these ways that our sense of self is less clear to us because we grow up and are socialized in a way where we're attuning to things beyond our individual voice.
What would you like to eat, Jessica? That's You use that example, such a mundane question, yet so powerful because we've been socialized in different contexts to, in your language, defer to others.
Yeah.
And this can lead to resentment or passive aggressiveness. And I loved how you tied that to a power analysis. You were saying passive aggressiveness is one way we respond to feeling powerless.
Mm-hmm.
And if we don't, if we lack consciousness about the past
Mm-hmm.
and the circumstances and relationships that created this sense of powerlessness, if we don't address it, it will continue.
Yeah.
Because it's not like our body can just like reform itself
Yeah.
just naturally. No, it needs to have some intent. We need to work. That's the nature of work. There needs to be self work
Yeah.
to raise consciousness about this powerlessness in the past that is creeping into the present. Um, and oftentimes that requires conversation with a care provider, whether it's a therapist, a pastor, spiritual director.
Mm.
Um, I want to I want to just reference something I heard at a story workshop by Sandhya Oaks.
Mm.
Really powerful workshop at the conference that we had in Philadelphia recently. And it was something along the lines of what you're saying, which is if we don't know our past and something in the past was really painful for us, it will continue in the present.
Mm-hmm.
Which is a very profound statement about the relationship between our past selves and our present selves.
Yeah.
It's basically saying our past selves, whether we like it or not,
Mhm.
continues with our present selves.
Yeah.
And the work of reflection, self-consciousness, therapy, spiritual direction, etc.,
Mhm.
is to reconcile those two so they become more congruent with each other. At least
Yeah.
that's my naive way of putting it.
Yeah.
Can you maybe share with us from your training and
Mhm.
expertise this notion of past and present coming together?
Yeah, yeah. But the first thing that comes to my mind, which we won't get into super detail about, but there are reasons for it at a neurobiological level, right? In terms of what's happening in our amygdala, especially if it's trauma related, there are neurons in our amygdala that get potentiated, basically like sort of like come online when we go through trauma, and it stays online forever unless it's intentionally depotentiated. So, with that general understanding, what Oak said is very true, right? And I think there's also, it's important to think about this not in an alarmist way, like, oh no, my whole past is always with me, right? I think it's this, we each have these full lived lives, and I think the gift on this side of heaven while we're living in our human bodies is the degree to which we can live as integrated people who can have full access to our histories, the courage to explore and unearth difficult things. That allows us to live fully in the present and have imaginations for the future. But when we have, and all of us do, but to differing degrees, right? Histories of trauma, deep grief and pain, and we don't know how to navigate it. This is common for the majority of people. The simpler thing, I will say, it's not easier. The momentarily simpler thing is to not address it, not look at it, because we don't know how to. We don't have the tools, right? And again, this is not the perfect analogy, but it's like finding out you have diabetes and you don't have any medical care, so you don't know how to address it, right? And so you try your best to change your lifestyle, but you're still having symptoms of it show up. You really need someone, a professional, to help you make sense of what are the symptoms you're understanding and experiencing now that could be connected to your past. And how do we look at it in a way that feels safe? There's a clear pathway, there's a good treatment plan so that you can look into your past without being activated, overwhelmed, flooded in your brain, and now it becomes integrated into your present self. So, this is sort of like very generally how trauma interventions work, but it is true, right? The unresolved things from the past will constantly be surfacing, especially in times of crisis and stress, because it's our brain's way of trying to cope, but it's what's the word? It's like short circuiting in a way.
The neuroscience explanations help. I appreciate
Yeah.
the neuroscientific framework. Something you said about this example with your children. So, kind of like, oh, my children are not being direct enough. They seem to not want to express themselves.
Mm,
So, you have a choice in front of you. Choice A is to say, "Hey kids, please tell mama exactly what you want." It's to be very direct.
yeah.
The other pathway, which is, what did I do to create the conditions where they feel like they can't say something to me?
Yeah.
And you're saying you've chosen that latter pathway. Like, unpack that for me, because
Yeah.
that's a pretty counterintuitive communication approach.
Yeah.
Um, why why do that?
Yeah. So I would say I am forever thankful for my training around gender and power, right? Like And from an MFT relational perspective, this is as much as it is about content as it is about felt processes. Okay. The energy, the process between people in relationships is significant. And I'm going to give a very recent example. I think this is last week. Okay. All of us who are parents know every day there are multiple encounters with your kids that are case examples for life. And so one morning I was taking both kids to school, like one to school, one to camp. I can't remember what happened, but I'd given them multiple, like, heads up, we're leaving in this many minutes. By the time we were ready, like time wise, I had to get home for a meeting. I was frustrated. I'm like, you did not, they're like playing Legos, whatever. They were not ready. And the pressure for time, they both got into it. Everyone was yelling and screaming. And instead of softening myself, I was so upset, I added to the intensity. So I was yelling, I was non empathic. Okay, this is therapist. I just wanted to validate and normalize for all parents. Even therapist parents do this. I added to the yelling. I was like, my daughter was crying. I'm like, you need to stop crying, get in the car. Okay. They both knew. I don't get that angry that easily. Okay. But in that moment, we were all in the car and it was quiet. And as I was calming down, I was aware they were being quiet. And I don't know if I don't think it's fair to characterize that they were afraid of me. I don't think my kids are afraid of me, but I think they were aware of my anger and thoughtfully staying quiet, right? They knew this is not the time to talk. Mama's upset. And so I did not like that my children are doing that because I'm asserting a power over that is not the way I want to be with my kids. So, in my own deep breathing, calming myself down, I then chose to say, hey, kids, I'm so sorry that in my frustration, Mama is stressed about time. I yelled at you both, and I'm wondering if something happened that I didn't know about. I just apologized, right? And I remember in that moment, my son, who's 7 years old right now, just very quick, he's like, okay, Mama, I'm going to tell you what happened. Like, I gave him permission because I softened, right? He didn't have to worry about me being upset. But with our history of the culture we've hopefully established in our family, he was ready to tell me. He's like, Mama, this is what happened. Like Liberty was crying because of this. And then I was like, thank you for telling me. And it was because of me. I had to change my energy and make myself safer and accessible so that my kids could talk. So, but it's like, it's so hard and has everything to do with controlling and addressing my posture. And it had nothing to do in that moment of like trying to change them. Like, older brother, you tell me what happened, right? I need to know, like, why were you both so upset? It was about the energy and the tone, not so much what had to be talked about, right? Yeah.
That is a very sophisticated and comprehensive understanding of all of the relevant communication aspects. So, in a systems theory perspective, there's three individuals in the car, there's a form of silence, and you're analyzing what this silence is communicating. And what it communicated is a silence out of a kind of recognition, somewhat fear of mom being angry, which was and you add this layer of power analysis, which was mom is an authority figure. And so you didn't want to use your power in that way to squash
Mm-hmm.
their voice,
Yeah.
their perspective. And so by verbalizing your apology, it gave permission for the others to engage back in. But
Yeah.
the key and salient communication strategy or principle here is you changed yourself.
Yeah. Yeah.
And by changing yourself, it had this parad from a person from a certain perspective, paradoxical effect
Hmm.
of affecting someone else,
Yeah.
right? So it's kind of like that's the way a system works,
Hmm.
is that we're all interrelated.
Yeah.
So when you move one piece of the system, i.e., you
Yeah.
self-regulate
Yeah.
through breathing, um, saying a quick prayer,
Hmm.
asking for God to guide us, it changes the system, which involves other people so that they can make a choice and do something or not.
Yeah. 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 Yes. And I want to highlight possible other outcomes, right? Which is common for all of us, which is as a parent, I could be feeling consciously or not, like I'm so overwhelmed and upset. My kids are making me feel this way, like, and have a general frustration where and I think all of us, when we realize we hold power in relationships, we can affect people in this way, which is we want them to feel bad for making us feel bad. So we give them the silent treatment. And because of the unspoken nature of those intense dynamics, children make sense of it in their own way. So this goes back to some degree of storytelling. The story that a child will then tell themselves is, I did something bad and wrong. I made mama upset. I'm responsible for making her feel better, right? This is all just internalized stuff. So, as a, I mean, I'm so grateful for so many things, but it's like, in these weird moments, I'm literally thinking through all this. I'm like, oh my gosh, if I don't say something, I don't want my kids to internalize that message because they are not responsible for how I feel. I am. And so once I own it, I can calm myself down, then they're released from that and they can go about their day, right? They're not carrying anything from our morning together. But this is why repair is significantly important. And I'll just say from a parent's, posture is there are multiple opportunities for repair, I think, every day. And when we don't, it's the cumulative effect of the stories that we both and our children take in and make up because we didn't get to clarify to them what is the real story, right? Like, hopefully, not real, but like, the story that is most helpful for all of us is, I'm responsible for my own feelings as a human, as an adult. And yes, I was frustrated by the things that they're responsible for, is like I gave them multiple checkpoints. They did not heed those. And in that, I was frustrated. Right. And so our son actually did say, Mama, I know you asked us to do this and we didn't, right? Like he actually apologized for the part that belongs to him. But as a child, what I want to make sure is he doesn't take responsibility for things that are mine to own. And that's where I think over time we can really love our children by taking care of ourselves, knowing ourselves. Yeah.
We're going to wrap up the conversation. I'm thinking back to the cut off relationship of my friend who is going to avoid Thanksgiving dinner
Yeah.
because of the rupture. And there's a family system dynamic there with relatives. There's some brokenness there. And the temptation is to blame that individual, blame this situation, which is to say, to not look inward, not look at ourselves.
Sure.
And what I notice in your example with your children is you did not blame them for your anger. You took responsibility for how you felt. And that almost gave you a sense of power back,
Mm-hmm.
like a sense of self-control back for self-regulation, which then gave you the freedom to re-engage the system. So I'll give you the last word. What counsel would you offer that individual who's
Mm,
maybe going to avoid Thanksgiving dinner because of some difficult family
yeah.
dynamics.
Yeah. Yeah. First, I want to say, like, I know I'm telling you this story makes me sound like this, lovely mother who's done all this self work. In the moment where this happens to all of us, when our prefrontal cortex is offline, we're functioning out of our survival brain. We all think all kinds of things about the people we are upset at in the moment. As a mom, I do that. I have this negative loop I will go into about my kids, right? But my job is to get my thinking cognitive brain back online so I'm not reacting out of emotionality. So, like, for your friend and all of us who have pained relationships with loved ones, right? And I think especially when it's elders or people who grew up in another context with very different sets of life experiences, um, I think it's safe to say the majority of our elders do not have access to the sort of learning about the self that we might have access to now, right? And in that, typically, right, there could be much more rigid thinking, right? That the frameworks that elders grew up in is a much more modernist society where there's clear right and wrong, black and white ideas. And oftentimes, when you live through very stressful war, all kinds of things, your brain is inclined to need clear categories, right? So, having a conversation about nuances, political nuances, theological, whatever, it is much harder, right? Because those clear cut boundaries or right and wrong, good and bad, is what allows some people to survive. And so I guess I think about a supervisor I once had is she would tell us if you find yourself working with a client and you're more inclined to judge them and you're irritable with them, you don't like them, so like some sort of transference thing is going on, right? Ask yourself, suspend judgment and ask what is going on? What is making it hard for you to have compassion and empathy for this person, right? And I know this might sound overly optimistic, and the truth is, I am a cup is half full person, but I do think that, and it has to do with our own self work, it is possible to get to a place where it may not, I don't mean, we're not even close to talking about forgiveness. So a lot of our Christian language takes us there so fast. I'm not even going there. What I'm saying is, all the resentment, bitterness, anger is completely valid. I think it's valid to have that and truly have been harmed by a relative and a loved one, and to ask the questions: what led this person to be the way that they are? How can I have more curiosity about that? Not with the expectation of releasing them or forgiving them, not at all. Just simply understanding, right? What makes them this way, right? How come their thought process is so rigid, right? What am I reacting to? Is it this conversation topic, or is it their posture, their way of shutting me down or cutting me off, right? So that, instead of focusing only on this person, it's like, help me understand them, but what about this dynamic then activates me? And that is the area to dive deeper into. And I think when we have the courage to sort of move in that direction and do a little bit of work at a time, then we get to live with more, I think, relational freedom, because we're not always getting activated by people, right? We can live a much more like settled life. So yeah, that those are sort of my final thoughts.
I so appreciate your final thoughts. Who doesn't want relational freedom?
Yeah.
This is wonderful. It does take self-work.
Yes.
Like this is my takeaway from our conversation is that relational freedom doesn't come like cheaply or freely.
Yeah.
It requires some investment and commitment from our side.
Yes, for sure. Yeah. And a
Yeah.
good therapist, someone who's trained, can really walk people through this. Yeah.
Well, Jessica, that is a really helpful note to conclude on. Thank you for taking the time to chat with me about rupture and repair, especially in the Asian American Christian community. And I know we'll continue having podcast conversations, but thank you so much.
Yeah. Thank you, David. It's actually, even just in talking, gives me opportunity to reflect and integrate these ideas more for myself. So thank you, David.